Hi everyone, my name is David Williams and today I'll be discussing the relationship between a relatively new type of diabetes medication called SGLT2 inhibitors and the risk of developing heart disease and stroke in people who have type 2 diabetes. If you have type 2 diabetes, you will have an increased risk of developing cardiovascular disease such as heart attacks, stroke, or peripheral arterial disease, which typically presents with leg pain on walking or with the development of infected or very painful ulcers. In fact, up to 80% of people who have type 2 diabetes will die as a result of heart or stroke disease. This is a potentially reversible problem and is best achieved really with effective dietary and lifestyle measures and possibly medication to treat your diabetes or heart disease that can be initiated by your doctor. There are many reasons why people who have type 2 diabetes have a higher risk of heart or stroke disease. If you're diagnosed with type 2 diabetes, you are more likely to suffer with obesity, high blood pressure, high cholesterol levels, and typically people who have type 2 diabetes have a higher level of the bad cholesterol called LDL cholesterol and triglycerides. And of course, if you have type 2 diabetes, you will be more prone to having episodes of low blood glucose or very high blood glucose levels, both of which contribute to the risk of heart and stroke disease. By identifying these risk factors in yourself, you can improve your dietary and lifestyle measures, and possibly your doctor can initiate certain types of medication to reduce your risk of further development of heart or stroke disease. If you have type 2 diabetes, you might wonder why your doctor is starting another type of medication for your treatment. From here, I'm going to be discussing more about a relatively new type of medication used for type 2 diabetes called SGLT2 inhibitors. SGLT2 inhibitors stand for sodium glucose cotransporter 2 inhibitors, which, whilst not the easiest type of drug to pronounce, are used second or possibly third line for people who have type 2 diabetes. They were introduced in the UK in just 2012, and at the moment there are 3 drugs in this class of medication that are used. These are empagliflozin, canagliflozin, and dapagliflozin. They work in your body by stopping the kidney from reabsorbing glucose from the urine. This results in higher volumes of urine produced because you excrete more glucose in the urine, which requires further amounts of water to dilute it. In fact, the average person using these tablets will produce between 4 and possibly 500 ml of extra urine per day. As a result, you remove the glucose from the body and therefore could potentially improve your blood glucose levels. As a result, these medications can improve the risk of heart and stroke disease through a number of mechanisms. Firstly, the use of SGLT2 inhibitors improves glucose control, as measured by the HbA1c, which is a 2 to 3 monthly average of your blood glucose control, by about 1%. These medications also improve weight loss by about an extra 5 kilos per person compared to lifestyle measures alone. They also significantly improve your blood pressure, and they significantly increase your urine output, which reduces the strain on the heart by reducing the blood volume. These can have a significant impact on your risk of heart and stroke disease. Of course, all medication come with side effects, and the commonest side effects that result from using these medications are thrush or urine infections. This is a result of the high sugar levels that are in the urine, which is a strong environment for bugs to cause infection. There are several studies which have investigated the potential role of using these medications to reduce the risk of heart and stroke disease in people with type 2 diabetes. The EMPA-REG trial was published 3 years ago and examined empagliflozin. The CANVAS trial, published last year, examined canagliflozin, and the DECLARE-TIMI trial is an ongoing study involving dapagliflozin. From the 2 completed studies in this area, SGLT2 inhibitors have been shown to reduce the risk of death from cardiovascular disease. They've reduced the risk of cardiac events such as heart attacks, reduced the risk of stroke, and they also may reduce the risk of hospital admissions as a result of heart failure. As discussed in my earlier slides, SGLT2 inhibitors probably improve this risk of heart and stroke disease by increasing urine production, which reduces the blood volume and therefore the strain on the heart in people who may already have underlying heart problems. But it's also important to remember that there are several ways this can be done, and also SGLT2 inhibitors do improve blood pressure, body weight, and glucose control, which likely contribute to this reduced risk of heart and stroke disease. So the take-home messages from this talk are that people who have type 2 diabetes have a very high risk of heart and stroke disease, and the use of SGLT2 inhibitors in some patients may reduce this risk of cardiovascular disease, as shown in several trials. As a result, these medications should be considered by doctors in people who have pre-existing heart disease, as it may improve their risk of further disease. These are the references that I've used for this talk. Thank you very much for listening.